Welcome to yet another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Alhassan. Now, jaundice is the most common condition in newborns that requires medical attention. Almost every newborn worldwide develops jaundice. Serious cases are more common in East Asia and amongst American Indians. Less common in Africans, but seems to occur more amongst populations of higher altitudes. Today on Healthy Living, we would look at what jaundice is, the causes, risk factors, preventive measures, and some myths associated with it. And to do that with us today is a registered nurse, Nora Moses Goddey. You're welcome to the studio.
Thank you so much.
How are you doing today?
I'm fine. How are you yourself?
Great, thank you. And thanks for coming.
You're welcome.
All right, we're discussing jaundice today, and I think I learned that it's quite a broad one. But before we start streamlining it to the main focus, which is neonatal jaundice, could you please tell us what jaundice actually is?
Well, jaundice, from the definition, it can also be called hyperbilirubinemia, but I don't want to use medical
Exactly,
terms.
because I'm beginning to wonder what does that even mean?
Okay, it's a condition that occurs when there's an elevated level of bilirubin in the blood. And majorly, it is the work of the liver in our body to excrete such from the body. So in any condition where the liver is not able to excrete such, there will be excess buildup, and then you have that jaundice.
Wow. So jaundice occurs just in babies?
No, not at all. Even in adults. Adults too also have jaundice.
Wow. Okay, so since our focus today is on neonatal jaundice, what does neonatal jaundice mean then?
Neonatal, that is babies that are just giving birth to within their first weeks of life. Let's say from birth down to like 2-3 weeks of life. So babies that have jaundice in that period, you can say they have neonatal jaundice.
Okay. So what are the symptoms, the signs and symptoms that one would see when those babies have been born that would tell that, oh, this child has jaundice?
Okay, well, for the start of the signs, you firstly see it on the face area.
Okay.
It starts from the face area before like generalizing to the entire body. For the face, when you are able to use your fingers, for instance, you just dap on the skin of the baby, you get to see a bluish discoloration on releasing your hand.
Really?
And yes, and even before that, sometimes if you are very observant, you can get to see that the white part of the eyes, I don't want to use medical terms,
Okay.
the sclera of the eyes might, instead of it being white as it should be, it might be discolored to like yellowish color like that. So that is just one of the signs. And depending on how fast it spreads across the body, even on the abdomen, on the back, but when you like use your finger to check, you might see this yellowish discoloration, but that is just like physical examination. That is not a definite sign for you to say, okay, my baby has jaundice, just because I suspect that. So that's just one of it. And your baby might be crying, very irritable, might have fever, but you know fever is just not to a particular issue.
Okay.
Fever is like a broad term, so it's associated to many issues. For that reason, on noticing those signs on your baby, if you come to the hospital, the first step we'll take, we'll also examine.
Okay.
We don't use hand in the hospital this time around. We use a device. It is more like bilirubimeter, like it's just for you to check the bilirubin level. It's just a little device whereby it is being placed. You'll see a little light, touch of light. We check the scalp, check the chest, depending on the areas, and then we read the values recorded. So that is just another step we take in determining if your child has jaundice or not. And we still have yet another way, that is a more advanced way to investigate if your baby have jaundice or not. And that is by checking the blood. That is the serum bilirubin level will be checked. Your baby's blood will need to be taken, and on checking, we'll now see the value. Depending on the range, we'll get to know if your baby have jaundice or not.
Oh, wow. That's quite the process.
Yeah.
But now, I've been wondering, I think a lot more children come up with jaundice lately. I think I've heard some persons say, oh, after giving birth, we're still going to stay in the hospital for like a week. The baby has jaundice here and there. Why has it become so common?
Well, you know, with the advancement of technology every day, even medically, there's advancement. The main thing is for children, most children are predisposed to jaundice. That is just the fact.
Okay.
And this is because of the kind of liver they have. their liver is not yet as matured as adult liver. Normally, this substance called bilirubin is content in the red blood cell of these babies, and because they were just giving birth to, it is the work of the liver that, as in the work of the liver is to excrete such bilirubin. But because of the prematurity of the liver, it's not that developed, it doesn't get to excrete it as much as it should. So they end up being what is it called, a build-up in the blood. And so because of that, there's more. And also gestational age matters. You know, if your baby is term, there's less likelihood of getting jaundice. But if your baby is not term, that means even the system, like most of the things,
that means like a premature birth.
Yeah. So these organs are not as matured as in term babies. So that is one of the reasons. And also there are some assumptions, but no conclusive study yet, that certain substances contain certain things that might predispose a baby to jaundice. Like I've heard of them saying camphor, but this is not medically certified. I'm just giving it as an opinion. They said like camphor, for instance, mothers that go about using camphor, that is a substance in it. I've tried checking, I've tried reading on that. I've never really seen.
Camphor for their clothes
or something. But I've not really seen something substantial that I can hold on to and say this is it. So generally it's because of the baby's immature liver. That's why they are always having jaundice.
All right, now let's talk about the causes of this neonatal jaundice, because I think there was a particular time a lady said she had to take anti-malaria while pregnant because she was told at the hospital, I don't know if it's a medical person that told her, that if you like, don't take the anti-malaria. By the time others are going on with their babies, you will be sitting down in the hospital with jaundice, as in your baby having jaundice. So is there any relationship between that, and what are the causes of jaundice? Okay,
to address that very issue you just brought up, well, certain medications might contain certain things that might trigger jaundice in babies. But like for a woman that might have malaria during the time her baby just come, she will not have as much time as the other woman who is not sick. She'll be able to nurse her child, she'll be able to give him or her much food than someone that is sick. So in that period, if she doesn't get to treat herself, for instance, let me going by the example, example you just cited, if she don't get to treat herself of that malaria and she allow herself to give birth before having such malaria, before treating, at the end of the day she will not feed her baby well. And if your baby don't get to eat much during those first weeks of life, there's more chances that the baby, I'll come to that. Let me start listing now. For the causes of jaundice, as I already mentioned, that the liver, that's the major cause, that because of the liver's immaturity, so it's not able to break down the bilirubin and excrete it. Another cause, or I'll call it predisposing factor, because you can't really pin your hand and see the exact cause, aside that because of the inability of the liver to excrete the bilirubin. The predisposing factors, something called predisposing factor, there are things that can increase the likelihood of getting certain things. So for that, I can say there are some mothers that are not having the same blood group as their children. Like it's called rhesus incompatibility. For instance, let me say I'm rhesus negative, that is O negative, and I happen to marry a husband that is O positive. Most likely I now get pregnant and the baby gets to inherit the blood group of the father, for instance, and instead of having my own blood group, which is O negative, the baby end up having O positive. In that case, you notice my blood and that of the baby is not the same, because I have the rhesus protein while the baby doesn't have it. No, sorry, I don't have why the baby has, because mine is negative. So in that case, by the time I'm pregnant with that baby, there's high chances that during the pregnancy, during labor, or during delivery, there might be an interchange of blood. And you know the placenta, that's what connects you and the baby. So in that situation, if there's anything that happens, if there's less care, less management, and anything happens that there's a breach in that very barrier, my own blood will go across to the baby. And then it will cause something called hemolysis, like hemolytic disease of the newborn. It will be more like, that is an aspect of the antibodies, because my body don't have that protein, those rhesus factor, while the blood of my baby have. For that reason, as it goes across, it will now form antibodies and go and fight against the blood of my newborn baby. Okay. In that case, the rate at which the red blood cells of that baby, as in, is destroyed, will be much more than just a regular baby. So, and the more red blood cells that are being destroyed, the more bilirubin we will have in the bloodstream. So, and most cases that we have that end up being complicated, most of them are associated to mothers of babies that are not rhesus compatible. So that is just an aspect of the causes of jaundice. And then predisposing factor, that's why whenever after giving birth, we always encourage feed your baby, feed your baby, feed your baby, because the more, since the liver is not able to excrete much, the more baby passes to, the level of the bilirubin in the blood will be reduced a bit, and so it will help.
You just said something. You said you always advise feed your baby. For first-time mothers now that are not able to feed their babies with their breast milk from the onset, are their children also not predisposed to neonatal jaundice? They
are. In fact, it will interest you to know that we have about like 4 or 5 types of jaundice. Generally 4.
Wow.
Yeah. For the one of the type of jaundice is actually breastfeeding jaundice.
Jaundice comes from breastfeeding?
We have breastfeeding jaundice, we have breast milk jaundice, and they're actually different. So let's just start from the first. Let me explain the breastfeeding jaundice. In a normal term baby, that the mother is nursing well, that is giving him or her breast milk very well. At the end of the day, after like about 5 days of life, we keep noticing that the jaundice level keep increasing, because we normally use serum test, the blood test, to examine the level of increase. So if baby is under phototherapy already, phototherapy, is the treatment that is mostly used to treat jaundice. Okay. So if while under that treatment, we only notice that it only keeps increasing instead of the level decreasing, and then this baby is as in breastfed and all that, we might end up linking it to breast milk jaundice. Though there's no definite component in the breast milk that we pin and say, okay, this is the cause of it, but widely acceptable studies have suggested that even within 24 hours, such breastfeeding be stopped, and we note if there's a decline in the range. So if at the end of the day, within 24 hours, the breastfeeding is stopped and the level drop, we'll get to know that, okay, that baby had breast milk jaundice. And then for the breastfeeding jaundice, that is in a situation where baby doesn't get sufficient amount of breast milk as he or she should get. That is like sub breastfeeding, because of the level, like you're supposed to feed your baby. You know, when babies are born, they don't really have much sucking reflex. Yes. And no matter how the sucking reflex might seem strong, it's possible they're not getting much. So at the end of the day, you might say, I'm putting my baby to breast, my baby is sucking, but what is happening? We are not sure of the quantity of breast milk baby is getting. That's why sometimes, if this is just like a tip, of course, you can decide to extract breast milk after giving your baby, because you want to create that mother-to-child bond. After giving your baby breast milk, you can still give your baby that express breast milk, so that at the end of the day, you are sure baby is getting adequate breast milk. So in such situation where baby is not getting sufficient, it can be called breastfeeding jaundice. That is just 2 among the 4 type of jaundice.
Please put us through the remaining 2.
Okay, for the next type of jaundice, it's called physiological jaundice. As I said earlier, most babies have jaundice, like because of the liver condition, it's expected that all babies have jaundice. The level will not estimate if it needs treatment or not. Anything less than, okay, depending on the day of birth also. For the physiological jaundice, this usually gets to be noticed around from day 2 to 3. That's why some mothers might wonder if at the end of the day they're in the hospital, they gave birth, and now say, okay, you've been discharged, go and come back in 3 days' time. So we get angry and say, but doctor, you're asking me to leave. Why not just check this baby now, and so that we'll get to know, instead of me leaving and having to come back. The type of jaundice we are checking out for is for physiological jaundice, because that doesn't get to show within the first 24-48 hours of life. That's why we normally give appointment and say come back in about 2 or 3 days after, so that we check for the level of jaundice. So any jaundice we get to see from that 3 days, that is the physiological jaundice, is expected. And if the range is not much, we can just encourage you to feed your baby and increase fluid and all that. But the other type of jaundice we have to discuss about is pathological jaundice. And that's the one from the term pathology. Pathology means something diseased. So pathological jaundice get to show up within first 24 hours of life. And usually such kind of jaundice, before you know, the level just keep elevating within 24 hours. Sometimes we don't even need, like I've been privileged to work in the NICU, that is Neonatal Intensive Care Unit, for almost 2 years.
Wow.
So sometimes we don't even need to wait before you can even ascertain and say, this baby is looking jaundiced. Sometimes even from the eyes, you just get to see, and then you now, normally as you are feeding the baby, now you just check the skin, as I explained earlier, using this part of your fingers. So when you get the but you never get the value, of course. So I'll now use that meter I talked about,
of course,
transcutaneous bilirubin check meter. So I just check, and depending on the value, if the value is looking high already within 24 hours, like if I'm able to check and I get a value of like 10 already within 24 hours, I'll just inform the doctor that see what I saw, and then the doctor at the end of the day will come, take a blood sample and then check. And usually, most of the time, we get to find out that the blood level in such cases is usually high of bilirubin. So those kind of babies, and mostly those babies, the babies that are of rhesus negative mother, as I explained earlier. Yes, so one of the first treatments of jaundice is elevated jaundice is phototherapy, because if the jaundice level is within normal range, around, for the first day of life, around 1 to, let's say 10, 12, that is very, for the first day, if it's more than 10, then it's pathological jaundice, and we need phototherapy or continuous treatment. But if within that first 2 days of life we check and we are seeing just like 5, we might ask you to come back in like 3 days time, let's check and know the value.
Thank you very much. I'm sure our viewers are getting much more enlightened. Just like you said earlier, you said some jaundice appear at birth. So I want to find out at what age range is at risk of jaundice? Let's say from newborn at maybe less than a few hours born. So what age is at risk of jaundice?
Okay, well, from the term, we are more into neonatal jaundice.
Neonatal jaundice, yes.
So neonatal, that is after birth.
Yes.
From day of birth, from the moment of birth to about 2 weeks of life.
Okay.
So for the gestational age, now we'll talk about the gestational age. That will be our focus. Okay. For the gestational age that are mostly at risk of jaundice, they are the preterms. And we have different categories of preterm. We have severely preterm, we have the moderate preterm, we have the mild preterm. So anybody, like any baby below 37 weeks, they are regarded as preterm babies. So most of them are at risk of jaundice than term babies. There are some term babies, when you check them, you get to see 5, you get to see 1, you get to see nothing. So such babies, they don't have jaundice.
So for a full-term baby that is already born and has lived for longer than 2 weeks, they are no longer at risk of neonatal jaundice.
Yes.
So that means they are now safe.
Yes.
So parents don't have to worry about them.
Yes.
Now, there's also this assertion that when your baby has jaundice, you probably just need to put them under the sun. I think there was a particular time I saw a lady with her baby under the sun in the morning. I think they were trying to take a picture, and someone just walked across and was like, "Why are you with the baby under the sun? Does the baby have jaundice?" It's like, I was wondering, what's the relationship between being under the sun and jaundice? So I wanted to find out, does anything have to do with the sun and jaundice?
Yes, it does.
Oh,
in as much as we have development in the science world and all that, will not refute the fact that ancient times had things in place to help sort out some things that we are now sorting using some technology and all that. So yes, but the question is, would you rather pick an ancient practice than for you to would you rather pick an ancient practice than for you to pick like something that is already technological, like something that is modern and scientific.
If you want to ask viewers at home, I'm sure a lot of persons will tell you Asian practice is still the best, but I don't know.
Okay. So initially then they used to always use the sun, but for now, since we already have like it's a more scientific way to go about this, is advised that you should bring your baby be checked, and if jaundice is found, phototherapy, that is, phototherapy means light therapy, be used on your baby. Because for that sunlight, for one, you can't calculate what your baby is getting.
Oh.
You can't calculate the amount your baby is getting.
Okay, there's a specific amount that the baby should get.
Yes.
Okay.
Like for that phototherapy light, we have something called icterimeter. It's just used to measure the degree of the light being delivered to the baby, and until it is up to certain amounts, you're just wasting your time. So imagine you just assuming and bringing your baby always to the sun. For one, you don't even know the level of jaundice your baby have, because the higher the level, the more risk. The more risk. I'm sure you don't want to risk your 9 months or your 6 months or your 7 months. You don't want to risk such and just go about the treatment anyhow. So it's always advised that you should bring your baby, we have a check, and if phototherapy is needed, you commence. But you know, as you said earlier, some people would rather go for Asian practices. There are some, even till today, with elevated level of jaundice in the blood, of bilirubin, in the blood, we keep begging them, this is your baby, we need to commence phototherapy. The parents will insist, and especially for some families that are relative, in-laws have say, you start hearing, no, my mother said this, no, my uncle said this, let's take baby home, we'll give baby milk, we'll give baby glucose. That's what I mostly hear, that we'll feed baby, we'll bring baby to light and all that. At the end of the day, you're endangering that baby. You're putting that baby at risk, because the more elevated, the longer an elevated level of bilirubin remains, the more risk that baby have. So sun, we can't doubt that the light from the sun will help, but it's not advised. Bring your baby to the hospital.
You know, that's where I'm beginning to wonder if jaundice can be cured by phototherapy, like you said. That's basically light therapy, right? Yeah. If it can be taken care of in that way, why is it so risky that it even takes the life of most babies?
It is very risky. There's something called the BBB, that is the blood-brain barrier. And you know how the system works. In fact, the whole human system is intertwined. We are all like a unit. So in as much as you have an issue here, you won't say it's just my finger that is having issue. It will affect you because you feel pain. So the same way, if you have elevated bilirubin level, the longer it stays, before you know it, it will go and pass through that membrane I mentioned, BBB. And you know, anything foreign that gets to cross the BBB and get to the brain, I'm sure you can assume what will happen. You can guess, and your guess you will not be far from the truth. Baby might end up having cerebral issues, and you would not really want that. So there's something called connectorus, that is the advanced level. When you do not treat your baby's elevated bilirubin level, if it continues in his or her body for long, baby get to come down with such complication and end up having cerebral palsy, hearing loss, and all that. So the longer it stays, the more harmful, and it can lead to death.
The longer it stays, the more harmful.
Yeah.
All right, let's go on a quick break, viewers. When we return back, we'll be talking about the preventive measures and solutions to jaundice. Welcome back, viewers. We're still discussing neonatal jaundice with Nurse Nora Moses Goddey. All right, ma'am, before we went on the break, you told us that it is harmful, and the longer it stays, the more harmful it becomes. And now let's talk about the preventive measures. But before we go there, we've heard that in our climes, we've heard that neonatal jaundice is mostly caused by enzyme defects in boys, and it varies in girls. Is this true? And does neonatal jaundice, does it appear differently in boys than in girls?
Okay, well, the associated study, but it's still not definite.
Okay.
There are some enzymes that have been linked to like more occurrence of jaundice. that is the deficiency of such enzyme. One of that is the phosphatase hydrogeoxynase.
You have lost us actually. We're lost.
Okay, one of the enzymes. Let's just use plain
better,
time,
please. Because
so
I'm
they
sure
just
our viewers too, though.
Yes, I'm
right.
sorry about that. So one of such enzyme is the one I just mentioned, and it has been said that such enzyme, lack of it in the body, might predispose. So it's not a definite. You can't just say this is it. It's just a likelihood that it's possible. And then regarding gender, generally there's something called the male disadvantage theory. It's just like when we have a preterm babies that are born before term. Sometimes we can have severely preterm babies that are just about, let's say, 22 weeks gestational age. There's more like chance of the female folks surviving than the male.
Why?
And that is linked to the boy disadvantage theory. I just cited that so that you understand what the theory is all about. That is because mostly women are like, we are more resilient. I'm sure you know that. You already know.
Well.
Yeah, so we are more resilient than men.
Yes.
That's why even our lifespan, even as adults, women's lifespan tend to be more than that of men. Because no matter what we go through, we tend to fight back, we tend to stand back on our feet, unlike our male counterparts.
Okay, so now let me pat myself.
Of course, please, you deserve it. So that applies also to babies. So that's why, just because of the male disadvantage, that is why it is being suspected that most male come down with, but it's still not a definite fact. And then when it comes to treatment of jaundice, it's just like having malaria. I can't say because I'm a female, you are a male, so my treatment will vary. Our treatment will vary. No, not at all. So the same drug that will be giving you will be giving me based on other consideration. To consider your weight, your age, the same way they will consider mine before they give me the accurate dose. So also for jaundice, there's no specific treatment for male babies or for female babies. Yeah.
Okay, then if jaundice actually occur maybe after a few days of life, a few weeks of life, why is it that mothers get discharged early? Because I've seen where people have to give birth. Probably you give birth in the middle of the night and in the next hour you've been discharged. And this child possibly have maybe pathological jaundice like you described. Won't that child be at risk of, losing their lives? Because at the end of the day, when parents are at home and people have started coming to visit, the first thing they start planning for is, let's start preparing for a naming ceremony. And most parents don't even want to take their children back to the hospital. So are they not at risk? Why do they always have to discharge mothers early?
Okay. So for the pathological jaundice, it shows within 24 hours. And within that hours, you're with us in the hospital. So if we suspect your baby have that, will not allow you go.
But there are situations where mothers have been discharged earlier than 24 hours.
Earlier than, yes,
fact,
like it's within.
30 minutes after giving birth,
it's
you can
within.
go home.
It's within. And immediately I see a baby that could possibly have jaundice from the physical examination. I might say this baby is looking jaundice. Until you see a reason to take the next step, you don't really have to. When you're talking about both health and all that, in as much as we want to care for ourselves, many things are to be considered.
Okay.
Financial aspects is also considered. Your hospital stay, for instance, it's not as if you are staying with us, you are not paying. You pay for the accommodation, you pay for other things. So if you just be with us, it's not as if we are giving you any care. We are also considerate. Instead of just keeping you, it's not as if we are doing anything to you. Why not go at the comforts of your home, stay with your baby, then come back when it's due? And also, nowadays, the way health is going, is negotiable. At the end of the day, I tell you, you are fit for discharge. You're telling me, no, you don't want to go. You can stay so long as I have where to keep you. When I will not agree is when you affect my other patients. Like if I will not have more space to take care of my other patient, then I will have to beg you to leave. But if I have enough room and you want to stay, you want to pay money, you can stay back. So for that aspect, we consider other things. And then within that first 24 hours, it's not only 24 hours. It's not at 24 hours. It's within.
Okay.
It's within that 24 hours. So after birth, I'm cleaning your baby. I'm seeing your baby. If there is need, I just suspect. The meter I talked about is not far-fetched. I will just pick it, check. And if I'm able to check, I didn't see him as in a high value, there's no point keeping you. If I see a high value, that's when I will now say, no, madam, you have to hold on. Let's check and see what the serum, what the blood is saying. On checking the blood, depending on what we find, before we know if we'll allow you to go home or to be like with us.
While checking, do you find mothers that are in denial, or the ones that believe religiously that this is not good?
Of course.
My child does not have jaundice. So how do you handle that?
We're Nigerians for one. And trust me, we have, it's not as if I'm saying spiritual aspects. No, I'm not against it. But being a medical person, you know where my stand is. So some people will be in denial. You keep telling them, madam, we just checked your baby. See. Holy Ghost fire. My baby can never have jaundice. If my mother did not have, I did not have, my baby will not have. So at the end of the day, you see such women in denial. Some will insist that they want to live. And there's a level of jaundice we see in your baby. In fact, it's no longer as in phototherapy matter. We can't even just do phototherapy. There's something called EBT, that is exchange blood transfusion. We have to even exchange your baby's blood. So we meet many women, especially the mothers. It's not as if I'm saying fathers are not involved,
very well,
but especially the mothers. You know how attached we can be. You know how emotional we can get. So most of them keep saying, no, you can't do this to my baby. They keep refuting the fact that there's jaundice, and such attitude we not help. But most of the time, what we do is, I'll sit you down, explain to you, and I'll just make sure you get to know that the well-being of your baby is what we are after. In as much as you want to go home, do you want to rush back with your baby? Do you want anything worse to happen to your baby? So you've endured this long to bring this baby to this world. Why not extend a little further? Just so you are sure that you are living with a healthy baby.
Talking about extending a little further, how long does jaundice last in the baby?
That question you can't really see exactly, because at the end of the day, it's individual difference.
Really?
Yes. If under phototherapy, like if we're able to check and the bilirubin level is not too high, let's say on day 3 of life, on coming back and we check and we got about, let's say 15 to 20, we can commence phototherapy. While under phototherapy, we carry on other management that the baby needs. We can talk on that if you want later. But if it's above 20, and we place on phototherapy, we see that it's not coming down, we might advise that the earlier we commence the transfusion that I said earlier, EBT, exchange blood transfusion, the earlier the better. And so in such case, the duration of stay will be longer. It's just like having, let me say, if you have 1 and you have 10, and I'm trying to clear it off, you don't expect you that have 1 to stay as long as someone that have 10.
True.
And at the end of the day, individual difference, depending on how your own body, how that baby's body is able to accept the treatment. So mothers, please, I'm using this opportunity to beg you people, don't listen to your friends, don't listen to your relatives that keep telling you, my baby had jaundice and stayed only 2 days, only 5 days. Your baby is different. Even if it's your first baby that had jaundice and stayed for 1 day, and your second baby is staying up to 2 weeks, please, we are managing as we see it. Each baby is different, and you need the patience, all the patience you can get, please. Please. I'm
sure they heard that. So now let's talk about preventive measures. How can one prevent their babies from having jaundice? Is it preventable?
Well, like, for instance, the resource incompatibility. I can say another way to prevent it, if you notice the kind of partner you're having and you don't want any likelihood of such, but it's still not a guarantee that you will not have a baby with jaundice if you stay off a man that is resource positive. So that is not even an aspect. When baby is born to life, like the first few hours matter, the first few days matter. That's why you see us encouraging mothers, take care of your baby, feed your baby. At least a term baby should get nothing less than 30 meals, that's like 1 ounce within 2 to 3 hours. So if you end up
of breast milk,
either breast milk or
any liquid,
okay. And even for breast milk, we even need more, because the rate at which breast milk digests is more than the breast milk substitute. So for the breast milk, you even need even more than that meal I mentioned.
Okay.
So within those few weeks, the few hours of life, is advised feed your baby as often as possible, nothing less than 12 times in a day. 8 to 12 times at least. And if you're able to time yourself around maybe every 2 hours, sometimes 3 hours, you end up getting that total of around 11 or 12 times in a day. So giving your baby food will help. The more baby pulls, the more baby will pass off that bilirubin, and it will reduce the possibility of getting jaundice.
Interesting. So now let's talk about, is there any link between child delivery and this jaundice? Because most of the time, like I made mention earlier during the first segment when I said most in the hospital, most nurses would tell their mothers and say, if you do not take your anti-malaria precisely while you're still pregnant, your child is likely to have jaundice. So what is the relationship between that child delivery and that jaundice?
Well, as I explained earlier when you brought the same topic up, it's just like if you are not fit enough, like if you're not that strong. In fact, generally, before conception, it's even advised that you go on preconception care, so that when the pregnancy meets you, it meets you in a better position than when pregnancy meets you and you're not too strong. You notice some of the symptoms you have to put up with. You not be well fit to care for it. So also, if you're not able to care for yourself, you end up not able to care for your baby after delivery. And also,
so there's nothing like if mother has malaria while pregnant, the child is automatically going to have jaundice after birth.
There's no direct link. But the thing with medicine is dynamic. It keeps changing. It keeps changing. I will not totally refute that very statement owing to the fact that it's coming from medical persons, but so far, based on my own practice, and I've not really considered that aspect. So it's something I will take my time and go and check through to see if there's any link. So I don't want to refute what I'm not even sure of.
True. So now let's talk about the management of jaundice.
Okay.
How do you manage jaundice if you discover that your child has jaundice?
Okay, the first thing I would advise is if you suspect, you come to the hospital. And then if diagnosis is made, that is, it is confirmed. So on confirmation, most time the first line of management is phototherapy. Phototherapy is a kind of therapy where you use the lights. Mostly it's blue-colored lights, fluorescent light, depending on the type the hospital is using. Some might come in form of blankets where your baby is being laid on. And during this phototherapy, your baby's genitals are being covered with diaper. And then the eyes are being covered also. That is in an attempt to reduce the rays coming from the light to meet your eyes, because there's a possibility of retinal damage, that is eye damage, if your baby's eye is focused, or if the light directly gets to your baby. And also there's a possibility that the genitals might be affected. That's why when your baby is under phototherapy, you mostly see them only on diapers and then a little eye cover just to protect the eyes. So that is just the first and major treatment of normal range jaundice. The next stage during the phototherapy, we advise fluid, because the more light, the more fluid is being excreted from the body. So for that, we used to make sure babies eat. Some of them will go on intravenous fluid. People call it drip. So during that period, most babies are being placed on drip. So it's nothing bad if you see your baby having a drip while under phototherapy. So aside the fluid therapy, we also encourage the baby to eat. That is, we always feed the baby at interval. That is when the range is normal. And then not normal when it's not too elevated. It gets to a level when if it's too elevated, above 20, we have to call you and encourage you that we have to exchange your baby's blood.
That's transfusion for a new baby.
Yes, and mostly the type of transfusion is not the regular, you just put blood to your baby. It's more like an exchange. We get to draw, mostly the range is about 85 ml per kg that we get to exchange. Like, let me say your baby is 2 kg, for instance. 85 times 2. I'm just giving an instance. So we withdraw blood from your baby. Let's say if we withdraw 20 mils and discard, we'll put in new 20 mil. We are like diluting the blood in that instance. So many people get scared when they hear of it and say, they are this, they get all worried. Some might even end up...
Do children survive that?
Yes.
Babies?
No, the death rate is very, 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 very small. Like, so far in my practice, I've never had any case where the baby died because of
that's relieving.
Exchange. Yes. So it's more like an exchange. And while we are carrying out that procedure, it's not like we just leave your baby, we are not sure. We mostly connect probes so that your baby's vital signs are being displayed on the system. If there's any abnormality, we'll now take action. So we are watching as we are doing the procedure, we are watching to ensure your baby is safe and fine during that period. So that is just another way of managing phototherapy. And then mostly after the transfusion, we get to also continue the phototherapy for a while before checking. We don't just immediately check. But sometimes we might end up withdrawing some sample. After the whole dilution, we might end up withdrawing a little blood to go and test and estimate. While we are waiting for the result, we'll continue for the therapy for your baby, after which in about 24 hours, we check again to see if it would have come down or not. So and also, sorry.
No, it's fine.
Okay. There's one more infusion that is being given, but mostly is in terms of resource incompatibility. There's one IV immunoglobulin that is also administered to some babies that are in need of it, but it's not the regular. So that is just peculiar to babies that need it.
In a layman terms, what would that be?
Okay, immunoglobulin, like I explained earlier about your blood. If you are negative and your baby's blood is positive from the father, like the O positive, and you are O negative, by the time your blood gets to meet, if no action is taken, it will just continue destroying the red blood cells of your baby, because it will see it as an antigen, like let me know this antigen, like enemies. So your soldiers will see your baby's blood as enemy and will keep fighting against it. So in such case, to prevent that from happening, we give the immunoglobulin infusion to such babies, and then even the mother gets to have a shot.
So basically, jaundice is blood related.
Yes.
But then, are there severity to the stages of jaundice, neonatal jaundice?
Yes, there are. Earlier, I mentioned a term called connectorus. That is like the complicated aspect. When it have reached that aspect, that's where we don't even want it to reach that aspect. That's part. We don't want it to reach that stage. So for jaundice, we have, once it's not normal, is abnormal. Then if the abnormal doesn't get treated, as I said earlier, the longer it stays, the more harmful it gets. So when it gets to the harmful stage, that means it have reached that connectorus, and that connectorus, that's where you already have your baby, as in having cerebral palsy, hearing loss, and all that.
Wow. So it can be that destructive.
Yes.
All right. So how do parents, new parents, caregivers, how do they support their babies when they are going through jaundice treatment?
Well, most times for babies that are undergoing phototherapy, especially for the first 24 hours, it's not easy for them. So most time you see them crying. Most time you see them very irritable. They keep shouting. So sometimes, depending on where such phototherapy is being carried out, if it's by the bedside where the mother is, then you will have to please, as much as possible, leave your baby under the lights. I know you are a new mom, you want to cuddle your baby and all that, but first thing first, when it's time for feeding, bring out your baby, feed, and ensure your baby feed as much and as often as possible, because the more food, the more frequency, the more possibility that the level of jaundice reduces. So to play your part, I know you love your child, you love your baby, feed your baby and keep your baby back. Try as much as possible. You might like rock the baby from the bed just to see how him or she keeps quiet. But don't say, "He have been crying now, you now hold your baby for 24 hours. At the end of the day, are just staying with us in the hospital. You are not doing anything because the phototherapy that brought you, you are not doing it. So that means we are just gisting. We'll just come, "Madam, how are you? You are just here with us. When you finish, you pay us money and go." So please, as much as possible, We know you love your baby. Allow your babies under the light. And also listen to your health professionals. They are begging you. They are telling you it's not that serious. Take it. It is not that serious if they tell you. It is that serious if they tell you.
It is not that serious, but yet. Anyways, let me not get viewers at home scared. Let's also talk about this. Is there a possibility of future problems for any child that has ever had jaundice? Future health problems for any child that has ever had jaundice?
Well, it's just like malaria. Malaria, for instance, if you are being treated and everything goes, that is it. But if malaria is being left untreated and it gets complicated, then you have to deal with the consequence. Same thing as jaundice. Studies so far have shown that it is safe. It is safe to take care of your babies and manage them using phototherapy. But if such babies are being neglected and it gets to the complicated stage, which is connectors, by the time your baby's brain is affected, we can't reverse that effect. So at the end of the day, it's not the phototherapy itself that have effects, it's the complicated aspect that have effects. So phototherapy generally doesn't have effect, but if allowed to be complicated, then we have to deal with the complications.
So like you said earlier, you said the reason why they close the eyes of children while they're going through the phototherapy is to avoid refractory error. So what about situations where maybe the children are screaming and they don't want their eyes covered? Is it possible to take off the cover totally?
No, it's not. It's never ever recommended to take it off. Because most times, within that first 24 hours, babies get irritable.
Yes.
But how will they get used to it if they are not under it? So you can't say, because my baby is crying, you just carry your baby and off you go. That means when you start again, you start all over. So if at the end of the day, your baby is crying, you carry your baby, pat your baby small and keep the baby. Your baby will cry again. Why not carry the baby when the baby sleeps? Put the baby back. If the baby wake up and start, you can, from the bed, just tap. Some might not cry, some might just be all clingy and all, they keep turning around. I know emotions can be there, but
yes,
as much as
possible. Most times you don't even want anything
possible
associated with them, and then you have their eyes covered. How do they even cope at that point? And most parents would probably just want to just yank it off immediately. So that's the damage.
They're doing more harm than good.
Wow.
They're doing more, and no professional will come in and see your baby under the lights and say, okay, continue since the baby is not crying. Unless the baby is not under that light. If you want to take it off, okay, take it off and off the lights. When you feel ready, you put it back. Okay,
so just like you were asking earlier, you said would someone rather do the ancient method rather than the technological method? Do you know there are lots of unorthodox methods of treating different ailments in Nigeria?
Yes.
That maybe grandparents have passed down from generations to generation. Now, let's talk. Are there unorthodox methods that treat jaundice besides going to the hospital, going through the phototherapy, and other
like from the whole pathophysiology, from the whole way jaundice works and all that, you get to see that is associated with the blood. And how can you really get to the blood other than what scientists have already proven that actually works for it? I don't know if you get my point.
Very well.
Like phototherapy have been confirmed. I don't know which other way. How will you get to the blood?
Before phototherapy came, before this ones came, people were
then let's associate it to sunlight. Let's just dash it to sunlight at the end of the day. Let's say sunlight. Maybe
what about, are there over-the-counter drugs that can handle that too?
No. Most times we treat by symptoms. No drug, no vaccine, no drug for neonatal jaundice. It's different from every other jaundice. So no any drug that you give.
In as much as babies tend to take lots of vaccine when they are born, there's no vaccine for neonatal jaundice yet.
No vaccine yet for neonatal jaundice.
But maybe there will be in the future.
Probably.
All right, I don't know if you have other aspects you want us to touch on that I probably didn't ask on before we round up.
Well, for the therapy, I think we've covered most of it.
All right, so what will be your last words to viewers out there? Mothers, caregivers, fathers as well, everybody. What's your last words to them when it comes to handling neonatal jaundice?
Okay. Jaundice is real. Let me start from there. Jaundice is real. Your doctor or your nurse is not angry at you. She's not angry with you, and therefore want your baby to stay back. They don't want to detain you in the hospital. We're not We're not holding you captive. When we tell you there's jaundice, there's jaundice. When there's need for management, the management we are presenting, please and please, in as much as you want a healthy baby, we are also there to serve you. So we want to deliver a healthy baby to you. So please and please, I know it can be difficult, it can be emotional, when you have to see your little baby under the light, you want to hold and all that. Please, go by the guideline, go by the rules. If you are advised to leave your baby under the lights, please leave your baby under the lights. If baby needs transfusion, the exchange blood transfusion to cure jaundice, and your faith allows you to, your conscience allows you to, please go ahead just to help that baby. I think that will be all for now.
Thank you very much for your time today. We really appreciate you. All right, viewers, I'm sure you've heard from Nurse Nora Moses Goddey. You have to always listen to your healthcare providers. And that's how we draw the curtains today on healthy living. I hope to see you again next week. I am Alhassan Olamide.